Hi, my name is Dr. Brad Reedy. I'm the co-founder and clinical director for Evoke therapy programs. Today, I want to talk about the efficacy for wilderness therapy of treating depression and mood disorders. And we can trace in wilderness therapy our roots back to an accidental experiment that happened around the turn of the 20th century. In San Francisco and in New York, for various reasons, they had to move the clients, the patients in the asylums, outdoors into tents. And what they observed at both of these sites was that the mood, the progress of the patients was immediately elevated. So we know that being outdoors, for many of us, we know that it can elevate our mood, that it can improve our spirit. And so if it was just that, only that, we would probably see some improvements in mood disorders and in depression. In addition to that, in our program, we focus on a healthy diet, a diet that's low in sugar, no caffeine. We try to use healthy organic foods without any preservatives as much as possible. And so we're providing a lot of the elements that we know that help with depression. Good diet, proper sleep, exercise, all of those things, when paired with therapy in the research, show us that outcomes are improved. And then so you have this backdrop, this stage, this vehicle of wilderness therapy. And then you overlay on that, like we do, you overlay on top of all of that traditional therapies in psychiatry. And then you combine all of that and you have fantastic outcomes. I want to talk about a couple of the other things that are really effective at treating depression and mood disorders in the wilderness. The microcosm of the small group is a fantastic way to observe patterns in relationships that are related to depression. Learn helplessness, a core feature of depression. That experience that no matter what I do, it can't make a difference is absolutely one thing that's improved for almost all of our clients in wilderness therapy. They do something difficult. They do something challenging. They accomplish things out in our program. And when they do that, they have a sense of elevated mood. Of course, a core feature of treating depression is learning how to feel. You know, depression is really the absence of feeling. It's like the emotions get dammed up coming out of the reservoir of emotion, of the self. And the person tries not to feel because if they cannot feel, if they can stop it from feeling, then they're not going to feel any of the pain. But what we know is that takes away all feeling. And so a lot of depression can be considered a block of feeling. And so sometimes the door out of depression is to learn to feel grief, to learn to feel sadness and hurt, and also to address those limiting beliefs that we have about ourselves and about the world. There's so much for the depressed person that we have to learn to let go of. We have to let go of certain ideas about ourselves and certain ideas in our relationships. And having that small group, recreating the same kind of dynamics in these small groups and being able to observe that in the daily living is a fantastic way to intervene. Part of the experience also for our clients is the systemic process. Working on letters to and from parents. Parents doing their own work. Sometimes in families, our systemic patterns, our homeostatic patterns, that's those patterns where we tend to reinforce the status quo. Sometimes this dramatic shift of attending a wilderness therapy program gives everybody in the family an opportunity to take a step back and to reset. And through the letter writing process, we can very clearly, very intentionally, and deliberately help families to change their patterns. So when clients also need an adjustment to their medication, we have a psychiatrist on staff who can help with that too, because we know that that's an important part of the equation for many people who suffer from depression. All in all, I've never seen something more effective, more dynamic at treating mood disorders and depression. It's like it's been designed and tailored for that. I was talking to a psychiatrist in New York a few years ago, and he was sharing with me some of his own studies around treating depression. He said, the reason I like you guys, because you're doing all the things that we do in our study to change and see the effects, and you're doing it outside, and you're doing it in nature, and you're doing it with exercise. So I hope that while many of us might not think intuitively that to go camping, to do therapeutic camping would be the thing that would cure the depression, that would heal the depression, that would help with the depression. It is, in so many ways, designed very perfectly to treat it and support the person. We have a compassionate approach. The relationship with the therapist and the staff is amplified because they're outside, because they're outdoors, because they're camping, because they're relying on us every day to help them stay safe and warm and dry and hydrated. All of those things tend to solidify and cement the relationship between the client and the staff. And so you have, like I said, all of the elements. We practice principles of dialectical behavioral therapy. We practice mindfulness and meditation, which also can help with mood disorders. And we also dispense traditional therapies like cognitive behavioral therapy to challenge the limiting beliefs that the person with depressed personality, with a depressive disorder suffers from. So all of this tends to create a wonderful package in treating depression. I hope this is helpful, and good luck to all of you.